busiest prescribers, the highest value prescribers in the US are receiving somewhere in the neighborhood of 2,800 touch points from pharma over the course of the year. That's essentially 8 to 9 touch points every single day of the year, solicitations from pharma, and that's become extremely difficult to manage from a healthcare provider's perspective when it allows the experience that the customers are having. That's why we really need to shift the focus and put the customer at the center of this equation, and that's where next best action framework comes into play. So this is a framework that leverages AI and machine learning techniques to effectively personalize, optimize, and harmonize the entire marketing and sales journey around the specific customer based on their individual needs. It aims to accomplish multiple objectives. One is to match to the channel and content preferences. During COVID, as a physician, do I like to engage in person, face-to-face with the sales representatives or not? Perhaps I prefer Viva Engage touchpoints. Am I open to mobile alerts through the apps that I have on my mobile device? Am I open to third-party email, pharma email? All these interactions, these attempted touch points need to be triggered, not when pharma is ready to push these out, but when the customer is likely to be receptive to those touch points, when they actually need to and want to engage with those touch points. So it needs to be triggered at the right time. The entire omni-channel ecosystem needs to be coordinated appropriately. That captures the entire non-personal promotion side of the equation, as well as the personal promotion and other non-promotional touch points as well. The customer-facing organization is much broader than just sales representatives. It encompasses medical science liaisons, thought leader liaisons, nurse educators, business reimbursements managers, and other roles as well. We need to be able to enable a continuous learning through the human channel, so the recommendations that this type of an approach provides to the customer-facing organization, do they actually resonate with the sales folks and medical science liaisons and other roles that cover that account or that customer? Does the insight make sense? Does the action make sense? But at the same time, as the customer is at the center of this equation, we need to learn from the engagement and sales behavior of the customer as well. All of the engagement patterns and sales patterns need to feed back into the process to enable this continuous learning. And finally, especially on the sales side, everything needs to be tailored based on the needs and the circumstances and contextual drivers of a particular geography around a particular customer, to personalize and enrich that conversation that the customer-facing organization would have with that physician at that point in time based on the needs of that customer. The entire spectrum needs to be enabled through advanced analytics, technology, and change management. I'm sure there are many in the audience who are interested in understanding, going a little bit under the hood and understanding how this works. So next best action consists of multiple components, and many of these AI and machine learning techniques that our team refined and adapted to pharmaceutical industry are also leveraged across multiple industries. I'll share some examples over here of 4 different processes or algorithms that work in conjunction in harmony. The first step is what we call the customer engagement index and affinity prediction. Customer engagement index is a composite index that captures the breadth of engagement across channels, the depth of engagement for any given channel, and also the consistency of engagement over time of a particular customer. Affinity is a preference towards a certain content or channel. So we actually leverage the similar algorithms to what Netflix leverages in terms of collaborative filtering. And we've developed a deep collaborative filtering version of that algorithm. And one advantage we have over Netflix is that we know a lot more about the healthcare providers and prescribers than Netflix does about their subscribers in terms of movie choices that might resonate with their subscribers. We're able to predict with a high degree of accuracy whether a specific content piece to which a customer has never been exposed, whether that would resonate with that customer or not. The second step is to evaluate the sequences that lead to particular sales behaviors and estimating with a high degree of accuracy what the resulting sales or engagement behavior would be if I were to choose to expose a customer to a specific touch point, a content and channel combination with appropriate timing between those touch points as well. We recognize those patterns and estimate the predicted behavior of the customer as a function of exposure. And that's very, very similar to the deep neural network algorithms, image recognition algorithms that Facebook uses, Instagram, Google Photos, Apple iPhoto, etc. In the digital industry. The third step is to generate a series of sequences. And in order to do that, we use the genetic algorithm, which many stock traders in NASDAQ are leveraging for their buy and sell decisions. We generate a series of populations of sequences through mutations and crossovers, and essentially evaluate those against a set of predefined constraints to make sure that we're meeting the strategic and budgetary and operational constraints imposed by the brand and marketing operations and sales teams, and craft journeys that are much more likely to engage the customers over time and lead to higher sales results. And finally, most AI and machine learning implementations have some degree of domain expertise or expert triggers embedded in the process. No matter how good the machine is or the algorithm is, it may not be able to predict the appropriate course of action or determine the appropriate course of action to especially rare market events, for instance, the entrance of a new competitor product in the market, or a new piece of clinical information becoming available on the marketing side that the machine may not be aware of. So certain pieces are fed into the process as constraints so that the engine can optimize around those specific set of constraints every other touch point that happens across the omnichannel ecosystem. We recognize and we learn the behavior, the patterns that lead to better versus worse engagement by studying the historical exposure of the customers to these content and channel pieces over time, and then we craft new journeys that are much more likely to yield significantly better engagement and ultimately sales results. So it all sounds great in theory, but does this work in real life? So let's take a look at an actual implementation as well. So I'll talk about a large pharmaceutical organization where the fully AI ML driven omnichannel set of next best actions have already been enabled across multiple franchises and multiple countries as well. I'll specifically focus on one of those mature franchises and their journey along the way. So the next best action implementations look and feel like analytically heavy implementations, which is a true statement. You can see that the AI and decision engine and algorithms are at the heart of this kind of an implementation. However, each program has many pieces of the puzzle, many components to bring this kind of capability to life and drive success for the organization, from digital analytics to field integration and marketing integration as well, content and metadata tagging and management, to upstream and downstream data and platform integration with multiple data warehouses, Viva CRM platform, Viva Vault, Salesforce Marketing Cloud, and several third-party vendors that essentially deploy some of these attempted touch points. Everything needs to be enabled through a strong change management program, which I'll talk about in a second. So this particular program went live in early 2019, and let's fast forward 6-7 months and let's look at the outcomes that came from this particular program. The next best action and AI recommended visits for the sales representatives were 50% more effective than standard organic calls that the reps would have made otherwise in any case. And the engagement levels improved significantly with the customers, around 30% improvement in overall digital engagement levels, despite fewer attempted pushes from pharma, which is great. And we can reduce the number of attempted touch points, yet drive a higher engagement in absolute terms and in percentage terms as well. That's a wonderful outcome for the physicians too. They're being exposed to fewer touch points, but they're much more relevant and much more timely based on their needs. And that also leads to a significant sales lift as well. A 35% sales lift, impactable sales lift was observed in this particular implementation. Just as importantly, a few key lessons that we've learned. This is truly a cross-functional team effort. Yes, it has multiple components that will be led by the insights and analytics and advanced data science groups. That's wonderful. But there are many additional functional teams that play a very critical role throughout the process. For instance, the customer engagement or customer experience groups, marketing operations, sales operations, and Salesforce effectiveness, field champions, certain district managers who are also involved in the program, training, and certainly business technology, and IT, as well as brand and marketing teams. So it takes a little bit of a village to bring this capability to life and drive this level of continued and sustained success over time. Generally, an agile approach works well, and aiming for a very good results that are not necessarily perfect. And we don't let perfect be the enemy of the good. With a strong change management program that speaks to the needs of individual stakeholders, from the representatives all the way to the internal, marketing folks. What's in it for me, and why do I need to adopt this new way of working, and all the way down to third-party vendors as well who need to adapt to this new way of working. In earlier years of these implementations, the third-party processes were much more challenging, because not only do they need to provide data from an upstream integration perspective, but they also need to be able to act upon the recommendations on a daily or weekly basis coming from an AI and decision engine, and that wasn't a trivial process for third parties. Now, many of them, especially the larger ones, are much more easily able to adapt to the recommendations to be deployed on a daily or weekly basis. And also, if we think about the capabilities that this enables, so I mentioned this is a 2019 program, so we had no way of knowing that COVID was in the horizon at that point in time as we built the capability. It enabled very rapid response to unexpected market dynamics and circumstances. This particular organization was able to dial up or down certain channel and content pieces within days, not weeks, within days after COVID-19 stay-at-home announcements. And they were able to adapt their content pieces shortly thereafter as well, and drove over a 50% improvement in engagement rates during the COVID period. And finally, a healthy degree of skepticism is expected around whether or not this kind of an approach would work with a large, mature sales force and a large, mature brand with low promotional sensitivity. And it was clear to the organization that it is indeed possible to create significant sales impact even with mature brands with low promotional sensitivity.